got a big show for you today. I sat down for an exclusive interview with Vice President J.D. Vance. Our first order of business, the brand new HHS report entitled Wolves in White Coats. It examines allegations that doctors and hospitals pushed and potentially profited from, quote, gender medicine for children. The report identified more than $60 million in insurance claims for those treatments. It included puberty blockers for kids as young as 13. This was all billed between 2015 and 2025. The report also details potentially criminal practices inside pediatric gender programs, including allegations that some providers used misleading diagnostic and billing codes to get insurers to cover the treatments. And look at the money involved. The report says the average healthcare cost for a minor is roughly $3,000. But for minors receiving transgender treatments, that number climbs to $75,000. If that minor elects transition surgery, it climbs to $170,000. So the question isn't just what happened, but whether or not anyone broke the law. And now, Vice President Vance is referring the report to the Department of Justice, calling for criminal prosecution of anyone who intentionally misled children in order to get them transgender treatment. I spoke with Vice President Vance today about this and the larger issue of fraud. Here's our conversation. Mr. Vice President, it's good to see you. Thanks for being with us.
Thanks for having me, Will. Good to see you.
So, Mr. Vice President, what I'm trying to figure out, and you can tell us with the release of Wolves in White Coats, is how much of this movement was driven by mass psychosis or ideology, and how much now was driven by premeditated financial windfalls, was a scam.
Yeah, well, I think unfortunately it's a bit of both. I definitely think that what happened at the level of parents and some of these young kids, and certainly the doctors, was a kind of mass psychosis. This idea that somehow because a 12-year-old felt like they were born in the wrong body, you were going to engage in long-term, very expensive, but very dangerous and underappreciated medical procedures. I mean, permanently altering these young kids' bodies in a way that was totally irreversible. But I think unfortunately that was being fed into by an insurance industry, by some physicians, and by others who are getting rich from these procedures. If you just look at things like endocrine disruptors, these hormone therapies that we're giving to kids, again, a lot of them completely irreversible, causing long-term damage to these kids. We know that some of the pharmaceutical companies were getting rich by encouraging doctors to prescribe these therapies off-label. And one of the things that we've worked on with Bobby Kennedy, obviously that was just announced, I know that you're covering it and I appreciate it, is that sometimes the doctors and the insurers were mislabeling these treatments in order to get financial reward, even though they weren't being honest about what they were doing. Because of course, if they were being honest, if they were going to the insurers and saying, well, we're actually butchering these kids, then that might have raised some alarm bells in the medical system. Instead, they said that they were treating for endocrine disorders or for certain pubescent disorders. And that was allowing them to list medical codes in the billing that allowed them to make money off of these kids suffering while simultaneously avoiding any real scrutiny. And we really see this, Will, as part of our broader effort to fight fraud. There's just so much fraud in our country. But unfortunately, one of the biggest purveyors of fraud was the small number of doctors, people who were getting wealthy by actually doing these procedures on kids, lying about the medical implications of it, and collecting rewards for it. Obviously not most doctors. I think most physicians obviously are good people who want to do right by their patients. But we do know, unfortunately, Will, some of these doctors were getting a lot of money by performing irreversible and untested therapies on kids.
So just to follow up, an endocrine disorder is largely a diagnosis for somebody with hyperthyroidism or thyroid disease or diabetes. And you're telling me that they were coding many of these gender affirmation procedures as endocrine disorders. And do you think in your mind then, and we have the stats on how much then that meant for the gender clinic and for the insurance company on what they could get out of a patient versus a regular child, something like $3,000 versus $170,000. So that billing, that coding, Mr. Vice President, do you think that's evidence then that what we're looking at here is not simply ideology, but an actual scam?
That's exactly right. That's precisely what we think. And that's why Bobby Kennedy and his team have done so much work to uncover just how much this mislabeled billing was feeding this gender transition madness. I mean, if you think about this, Will, you take a highly controversial, experimental, untested medical procedure like gender transition for a minor. A lot of insurers, a lot of physicians, they're not going to support that stuff. They're not going to fund that stuff. And that means there isn't any money in it. But if you fraudulently label it as something else, as treating an endocrine disorder, then you can get a lot of money even though you're doing something very experimental and very untested. And again, this is why I say it really was two things happening simultaneously. I mean, we know that there were 12-year-old girls, especially because it was more common among girls than boys. It happened with both, but it was more common with girls than boys. They'd get on social media. They'd take feelings that were kind of normal for any adolescent, a certain discomfort with your body, with the changes that happen during adolescence, but then they would be lied to by some in the medical community, told that if you let us do these procedures that are going to make some of the doctors a lot of money, then somehow that's going to fix what you're feeling. When in reality, what these kids needed is what a lot of adolescents have needed through the generations, which is somebody to listen to them, somebody to talk with them, somebody to try to understand them, not somebody to try to get rich by doing medical sanctioned butchery, which is exactly what this is. The financial part of this will, I really do believe it fed the ideology. They fed off of each other. And unfortunately, it was a lot of kids who suffered because of it. We're putting a stop to it, though, Will, and that's the good news.
Well, grotesque. This isn't the only fraud that you have been focused on.